name's Dixie. I'm a student nurse at SVSU. I'm just going to do a head-to-toe assessment on you, okay? I'm just going to start by asking you, what's your name?
Shelby Chedarisky.
And when's your birthday?
November 2nd, 2000.
And can you tell me where we are?
Saginaw.
And can you tell me what date it is?
November 29th, 2021.
Perfect. So you'd be ANO times 3, which means you're alert and oriented to person, place, and time. I'm just going to ask you some health history questions, okay? Do you have any allergies?
No.
Any surgeries?
I had 2, one in 2019, one in 2020 on my right ACL from cheer.
From cheer? Any pain with that?
No.
Any hospital stays?
No.
No? What about medications?
I'm not on any.
Not any medications? Do you have any diagnosis that you're concerned about?
No.
What about family history? Anything?
Hypertension, but I've never had a problem with it.
No issues with that? Perfect. Do you smoke?
No.
What about vape or tobacco? Alcohol usage?
Yes.
Yeah? How often?
Like maybe 1 to 2 times a month.
And what do you drink?
Seltzers.
Seltzers? Okay, perfect. Can you tell me a little bit about your exercise?
I don't go to the gym very much, but I work as an aide at Covenant, so lots of on my feet and lifting.
Oh yeah. And can you tell me about your diet a little bit?
I get fruits and vegetables in once a day.
Somewhat healthy person, you feel? All right, perfect. I'm gonna do some vitals on you. All right, here we go. All right, I'm gonna have you hold this little pink thing, okay? All right, I got about 112 over 74. Is that about normal for you?
Yeah.
Beautiful. All right, so now I'm just going to take your pulse, okay? All right. All right, so I have your heart rate at about 64 and your respiration's at about 16, okay? All right, so I'm just gonna, with your pulses, I'm just gonna make sure that they're even, okay? For your brachial. Medial. Perfect, your pulses are even and at 2+. I'm gonna check your temperature of your skin. All right, flip your hands over for me. Beautiful, your temperature is bilaterally equal. I'm gonna check your capillary refills on your fingers. About 1 second, that's good. Any pain, abnormalities, arms, hands, any of that? All right, no lesions are visible. I'm gonna check your muscle tone. Perfect, so now I'm just gonna check the temperature on your legs as well. All right, beautiful, your temperature is bilaterally equal. So now I'm gonna have you do some funny things with your arms. Bring them up, do some circles for me, forward, backwards. Any pain when doing that? Awesome, okay. So I'm gonna have you put your hands right here, flip them back and forth as fast as you can. Perfect, give me an okay. And fingers, perfect. Your cerebellum function is good. I'm gonna have you push out, perfect, and push in, and up, and down, beautiful. I'm gonna kind of do the same thing with your feet, okay? All right, have you push up, and down, and out, and in. Perfect, give me a couple flutters, wiggling around, beautiful. So now I'm going to start with your head. Have you had any like concussions or head injuries, head trauma?
Just one, but I saw a doctor and I was fine.
Good. Are you worried about like any itching or like lesions, anything like that? Is that your real hair?
Yeah.
Just a little color, nothing major. All right. No pain?
Nope.
All right. No lesions noted. Awesome. I'm gonna check your ears. Do you have any issues with your hearing?
No.
Or your ears at all?
No.
Get frequent ear infections?
No, no.
Beautiful. All right, great. So I'm going to feel your sinuses, okay? Any pain?
No.
All right, what about here? Any pain here?
Nope.
Beautiful. I'm gonna do your lymph nodes, okay? So I have your occipital, your pre-auricular, post-auricular, submandibular, we have your submental, you have your cervical chain, and then we have, shrug for me, your supraclavicular, perfect. While I'm here, I'm gonna have you shrug your shoulders for me, perfect, that's cranial nerve 11. And then I'm also gonna do tissue turgor, awesome. So you have no tenting, which is good, it means that you're hydrated. I'm gonna have you make some funny faces at me, okay? I'm gonna have you puff out your, perfect, and exhale, great, and eyebrows up. All right, perfect. That is going to be cranial, your facial nerve, your facial cranial nerve. Now what I'm gonna have you do is I'm gonna have you close your eyes. I'm gonna have you tell me where this is on your face, okay?
Okay. Forehead, left cheek, right cheek, chin.
Perfect. So now I'm gonna go to your eyes real quick and I'm gonna take a look at your eyes. All right, beautiful, beautiful. All right, I'm gonna have you put your finger on your nose and on my pen light, back in your nose, beautiful. Now follow my pen light for me with your eyes only. All right, and then I'm gonna have you look at my finger and look at the pen light. Beautiful, I'm gonna check your sclera. Look up, look down for me, no discoloration, and your pupils are something called perla, which means that your pupils are equal, round, react to light, and they do something called accommodate, okay? We're gonna move on to your nose. So have you had any dissection?
What cranial nerve is that?
These are cranial nerves 3, 4, and 6.
Okay.
And then I'm gonna check your nose. Are you having any pain?
No.
Have you ever had like a deviation in your nose? All right, I'm gonna have you close your eyes for me and tell me what smell.
Toothpaste.
Perfect, that is cranial nerve 1. And then now I'm gonna have you clench your jaw for me and unclench and clench again and unclench, perfect, that's cranial nerve 5. I'm gonna take a look inside your mouth, okay? All right, open nice and wide, great, move your tongue around a little bit, awesome. I'm gonna use my makeshift tongue depressor here. And I'm gonna have you say ah. Perfect, your mucosa is pink and moist, and those are cranial nerves 12 and 9. All right, and I think I am going to move on to your back, okay?
Okay.
So I'm gonna have you take off your shirt for me, kind of sit on the edge of the bed. And while I'm back here, when you're done, I'm just gonna check your trachea is midline, so that's good. Have you ever had any issues with your spine?
No.
No? All right, your spine is straight. It's good. I'm gonna check your thyroid, okay? I'm gonna have you swallow. Perfect, and swallow. And swallow. Beautiful. Any pain there?
No.
All right. And is this back acne normal for you?
Yeah.
Yeah. All right. So what I'm gonna do is I'm going to palpate. I'm going to percuss your lung sounds. Okay. All right. Awesome. So now I want you to tell me if you need a break, okay? So what we're gonna do is we're gonna take some deep breaths in and out, okay? I'm gonna listen to your lung sounds. Actually first, I'm going to have you take a deep breath for me, in and out, just to make sure that your lungs are opening and closing together, and they are, on inhalation and exhalation. Now I'm gonna listen to your lung sounds, okay?
Okay.
All right. So just tell me if you need a break. We're gonna do it a couple times, okay?
Okay.
All right. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. I'm gonna go under your shirt. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, and last one at your bases. All right, so your lung sounds are bilaterally clear, so that's good. And I think I've checked your thyroid. I'm gonna take a look at my paper real quick, okay?
Okay.
All right, great. So I think I'm gonna have you lay down now, okay? Let's move all these pretty pillows out of the way. All right, and I'm gonna get you. You can unplug it. I'm gonna get you covered up here. Beautiful. All right, so first I'm gonna check for something called JVD, okay? So I'm gonna have you look that way. Beautiful. And I'm gonna palpate your carotids just one at a time, okay? Beautiful. I'm also going to listen to your carotids, okay? And that's going to be with the bell of my stethoscope. And hold your breath for me. Beautiful. And the other one. Hold your breath. All right, great. There are no bruits that I hear, and that's good. So next we are going to listen to your heart sounds, okay? So we're going to start at your aortic, and we're going to listen on both sides, so it'll be a couple tries, okay? All right, so we're going to start your second intercostal space, your aortic, and we'll move over to the second space, and this is your pulmonic. Alright, and then this one's a little funny. This is like your third intercostal space. This is your herb, so it's going to be a little bit in here. Beautiful. Flip it around. Alright, and then we have your tricuspid. This would be beautiful. Oh. And finally, I'm going to listen to your mitral for a minute, okay? right, beautiful. I got about 64 for your heart rate, which is about what we got last time. So next I am going to move down to your abdominal area. Okay, so I'm gonna pull this down, have you pull your shorts down a little bit. So first of all, I'm just gonna take a look. Okay, I'm gonna note it doesn't look like you have any like bulging or abnormalities. I can say your pulse, that's good. All right, so I'm first gonna start by listening. Okay, so I'm just gonna listen to your bowel sounds. Awesome, and then while I'm here, I'm gonna listen to your abdominal arteries, okay? So, all right, so here we have the aortic, the renal, the iliac, and finally the femoral. Awesome. All right, so now I am going to percuss your abdomen, okay? Pull these down a little bit. Awesome. All right. Perfect. We're gonna find that dull area. That's gonna be your liver. Beautiful. Stomach is hollow. That's good. Beautiful. Now I'm going to palpate. Okay, just let me know if this hurts. Okay, I'm gonna do some light palpation. Any pain? Nope. All right, and then some deep palpation. No pain there?
No.
All right, awesome. I'm gonna move down to your legs, okay? We're gonna cover you up.
I'm sorry, I didn't start you.
All right, so I'm gonna start with your capillary refills on your toes. Sure, good. Feet are a little chilly, that's normal.
Yeah.
All right, great. I'm gonna check your pulses and have you bend your knees a little bit to your popliteal. All right, and then you have your posterior tibial pulse, and then you have your dorsalis pedis, which is on top of your foot. All right, great. And then I'm gonna check for edema, which is not present, which is good. It means that you are hydrated. Next, I'm going to do dull and hold on, let me look at my paper. Oh, I'm gonna do dull and sharp. Okay, so what I'm gonna have you do is I'm gonna have you close your eyes. This is going to be dull, and this is going to be sharp. Okay? Can you tell the difference?
Yeah.
Perfect. I want you to tell me where it is on your leg and what it is. Okay?
Okay.
All right. Here we go.
Sharp right shin. Dull bottom right foot. Dull bottom left foot. Sharp left above the knee. Dull right thigh. Dull top right foot. Dull top left foot. Sharp left shin.
All right. Perfect. All right. So you got 7 out of 8, which means that your function's good. Okay? I'm gonna have you now. I'm gonna have you. You can put your shirt back on. I'm gonna have you sit back up for me. Alright, perfect. And I'm gonna have you just kind of sit on the edge of the bed real quick for me. Are you feeling dizzy at all?
No.
Alright, I'm gonna check your reflexes. There we go. It's hard when you think about it, isn't it?
Mm-hmm.
Okay. And then I'm gonna have you put your shoes on for me. Do you need help? You can bend down. You don't feel dizzy.
I can do it.
Thank you.
Oh.
All right. So when you stand up, I'm gonna have you stand up slowly. We're just gonna wait there for a second, okay?
Okay.
All right. Ready? Beautiful. You don't feel dizzy, nothing like that?
Mm-mm.
All right. Perfect. I'm gonna have you stand with your feet shoulder width apart. Close your eyes for me. We're gonna do a Romberg test real quick. Awesome. So you have a negative Romberg, which is good. So now I'm gonna have you walk normally just to that chair, okay? All right, perfect. And then heel the toe back for me. Awesome, great job. And I'll have you sit back down on the bed. And finally, I'm gonna give you a Braden score. A Braden scale just tests like how at risk you are for pressure ulcers. Mm-hmm. And you have a good diet. It seems like you get enough exercise. Do you have any issues like dressing or going to the bathroom, anything like that?
No.
Great. So I give you a score of 23 on the Braden scale, which is good. It means that you have a low risk of pressure ulcers. And yeah, looks like we did it. Great job.
Thanks.